Good afternoon, everyone. My name is Kim Bittner, as Matt had indicated, and I am with the ESRD National Coordinating Center. Thank you for joining us for the ESRD NCC Patient Education Quickinar. The ESRD NCC Quickinar events are held in partnership with the Centers for Medicare and Medicaid Services. We are holding these events, these 30-minute events weekly. They feature patient and professional subject matter experts from around the country, sharing how they or their organizations are coping with situations related to COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted on the NCC COVID Quickinar webpage, usually within 3 business days at a minimum. So now let's go ahead and get started and take a look at the agenda for today's call. Today we are joined by 2 speakers, Janice Starling and Dawn Edwards. Janice Starling is a kidney transplant recipient and is a legacy subject matter expert with the National Patient and Family Engagement, Learning and Action Network, which is a group of patients, caregivers, healthcare professionals, and other people interested in kidney care who work together to help to make healthcare better for kidney patients. She's also the founder of the All Kidney Patient Support Group. Dawn Edwards is a nocturnal home hemodialysis patient, and she is also a subject matter expert with the NPFE LAN. She's also the CEO of the New York State CKD Champions. They will be discussing our topic of remaining connected while practicing social distancing. As we go through our panel discussion, if you have any questions, please submit them using the chat feature through the WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So what is this call about? Can I have the next slide? There we go. You will hear from patients using creative methods to remain connected in this new environment. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And then this series of calls is available to you weekly, offering a variety of topics. I'd now like to introduce Janice Starling. Janice is the founder of the nonprofit All Kidney Patient Support Group, which is based in St. Petersburg, Florida. It was established in 2009 to support kidney patients at various stages of dialysis and transplantation. Janice was diagnosed with kidney disease in 2000 and has done in-center hemodialysis, peritoneal dialysis, and home hemodialysis. In December 2013, she received a kidney transplant. Janice's lifetime goals consist of bringing about continued awareness, education, and advocacy about end-stage renal disease. Welcome to the call, Janice.
Hi, so happy to be here. Happy to be here.
We're happy to have you, Janice. So let's start off. If you can share with us your initial thoughts when we began practicing social distancing. How did this impact you, and what practices or routines did you have to change?
Well, first of all, we couldn't have our monthly meetings, the All Kidney Patient Support Group. So I had to think of what could we do, how could we reach out. So we started group texting and emailing and talking to the social workers to trying to figure out how can we communicate and meet the needs of patients in the kidney community. That was the first thing. How am I going to reach the needs of the kidney patients?
Okay, excellent. Great response there. And how are you remaining connected with patients? What are you doing now?
Wow, just today we just did a food drive. We gave at least 50 kidney patients food today. So what have we been able to reach patients through emailing the social worker and sending a flyer, and the social worker giving a flyer to the dialysis patients, texting, mass texting. Also, we've been able to do phone calls. Patients have been calling and All Kidney Patient Support Group and talking to different patients with different needs and letting us know of their needs. Zoom, we have a Zoom meeting coming up. So we've been using Up Radio for the month of March. We broadcasted each Wednesday. We did a broadcast about how to live healthy on kidney disease, and I talked to American Association of Kidney Patients, Joe Karen, LifeLink, and I also talked to Allison at the NCC network. So we've been using all means: radio, email, computer, texting, phone calls, all of it, to stay connected.
Well, you are definitely busy with trying to reach out and use different resources. What are some of the patients talking about with you, and how is the environment impacting them?
A lot of the patients are calling in and discussing the different changes in the centers because they have to wear their mask the whole treatment. So patients are concerned about, how can I keep my mask on? I have some patients who are diabetes patients saying, I need to eat. So that's been one of the concerns. And I talked to Allison, and she told me that they can have a hard candy, some orange juice or something, but they can't have a full-blown meal while sitting in the chair at dialysis. So that's been one, because they have to keep their mask on. Another patient was concerned about, how do the centers are using masks every day, so they were concerned about reusing the mask. So I've been looking at ways to meet the dialysis center needs and supplying them with masks for patients so they can have their own mask, a new mask every day. So those are some of the things that patients have been calling and discussing, and, different situations in the pod. How do I deal with somebody that likes the lights on and somebody that doesn't like the light on? So it's been different situations that's been coming up since COVID-19, and not being able to have family members come into the dialysis center. So that's been what patients have been talking about.
So previously you also mentioned using a lot of different resources and technology to stay connected, since we're not able to kind of meet face-to-face.
Yes.
What recommendations?
Go ahead. What
go
recommendations?
ahead. I didn't mean to cut you off. No, go ahead.
Okay.
Go ahead, Janice. I didn't mean to cut you off.
The recommendations that I found that it makes it very easy is when I email the social workers and send the social workers and keep the social workers in the loop. And then the social workers, since I'm not able to get into the centers, the social workers is able to give the dialysis patients the information. And then the dialysis patients have been able to call me and discuss with all kidney patient support groups some of their needs. So we've been able today, we was able to meet food needs. In the process of giving out the food, different boxes, I've also give out literature. Today we gave out literature on being prepared for hurricanes. So I was able to pass out that literature. So while I'm feeding, I'm also educating, because I put that also in the paperwork in their box when they're getting their food. So texting, sending out mass texts, calling, talking to patients. I was able to talk to a patient who was in need, and they was talking about the different things that goes on in the dialysis centers. And by me was a patient, being able to tell them and express the needs to kind of have a little bit empathy, I can relate to what they're going through by sitting in the chairs.
Very nice. And what recommendations do you have for fellow patients when they're reaching out to other patients? What would be the best way for them to get started, especially with using this technology?
First, they need to learn how to use Zoom. That's one of the things that I'm trying to educate patients, is how to use Zoom, how to use Zoom technology, how to text. Some phones, I found out that some people don't have a text on it. They don't know how to text on the phone, but they know how to make phone calls, so they reached out through a phone call. Also, my family, we did a family Zoom meeting to stay connected with our family members that's out of town, and we have a family member in New York and in Arkansas. So we was able to do a Zoom family meeting. So that was a great way to reach out to our family members. And then we also have a family group text, which we text everybody, and everybody knows everything, so there's no gossiping. So it's texting and emailing. That's another way to reach out with your other friends if you're worried about social distancing.
Okay. Well, Janice, I want to thank you for sharing this information with us. I'm sure we're going to have some questions, so We'll get back with you later on in the quickinar. But thank you for sharing this wisdom with us on this call with us today.
Thank you. You're welcome.
And now, absolutely. And now I'd like to introduce Dawn Edwards. Dawn is the CEO of the New York State CKD Champions, which is the advocacy and education group she was instrumental in founding. Dawn was diagnosed with kidney disease in 1992 and is currently using nocturnal home hemodialysis. She has also done in-center hemodialysis, peritoneal dialysis, and short daily home hemodialysis. Dawn states her biggest accomplishments were reinventing herself after mastering home hemodialysis, starting New York State CKD Champions, and re-entering the workforce as a home dialysis advocate. Thank you for joining us, Dawn.
It's great to be here. Thank you so much for inviting me to participate.
Oh, we're happy to have you on the call. So what was your immediate concern when we first learned about the need to practice social distancing?
When I first heard that we had to practice social distancing, being from New York, which is what they're calling ground zero of the COVID virus here, my first concern was the in-center dialysis patients. As a home dialysis patient, I wasn't really concerned about myself because I knew I had supplies. I knew that I had all that I was going to need. I had backup. But I knew that things were going to change in the dialysis centers and the way that clinic visits and dialysis treatments were going to be performed. So I was really worried and concerned about patients receiving enough information to be able to understand the severity of this situation and how to deal with the emotional impact of all of these changes.
Those are excellent points. Now, you're a kidney patient advocate who connects with other patients. How has this environment impacted you?
Well, I miss more than anything being able to be out in the field. That's something that I did just about every day. I would go to different clinics and meet with dialysis patients and staff members, talking to them and sharing and learning from them as well. And also giving out hugs all the time. That's one of my kind of signatures that I love to touch and let patients know that things will be okay and hold their hand and let them know I understand what they're going through. But now, I have to provide that love and support from a distance through social media and the internet. So it's also affected me financially because that was my job. So I'm not able to work. So I'm not considered an essential employee, and I'm not going to be out in the elements now. So social distancing has really affected me on many levels.
Well, thank you for sharing that with us. As a patient, how have you been sharing your experiences with others, and what techniques have you been using in order to connect with them?
Well, I'm not really a telephone person, but I have learned to acclimate and become more of a telephone person to connect with people whose telephone numbers that I have. New York State has over 29,000 patients, so it's really difficult to reach out, in that way. So I've also been using the internet, contacting people through webinars and Zoom meetings. Our ESRD network has support group meetings that are held on Wednesdays and Thursdays. I'm always on the support group meetings, and I've been aligning myself with other organizations who are providing support to our patients through conference calls and webinars. And I've also been working through my Facebook group, trying to grow my group so that we can reach out to more patients, and we started a public page for patients that were on Facebook that didn't want to be part of a group but just wanted information. And I've also been doing broadcasting on Facebook Live with Urban Health Outreach Media.
Excellent. What are you hearing from patients about how this environment is impacting them?
Well, in New York, initially, patients were very, very resistant to the changes. I would even say defiant in some cases. Changes were made to treatment schedules, treatment times were shortened. Some patients had to be moved from a COVID-positive center to a non-COVID center. And a lot of these things weren't really explained in a way that patients really understood what was happening and how these changes were really necessary to keep them safe. Particularly in New York City, you know, we're so heavily impacted. Patients are so afraid, and then there's so many patients that live alone, or now they don't have access to family members and friends, and they're trying really hard to cope with some of the feelings of isolation that you may have from really having to stay indoors, and not only indoors, but stay away from other people. So that really heightens the feelings of isolation.
Yes, I can agree with that one for sure. For my final question for you, what have you learned through the changes that you've made by continuing to be connected with your fellow patients by practicing social distancing? What have you learned through all this with COVID-19?
Yeah, I have to agree with Janice. You know, I learned that we have to always depend on our inner spirit to guide us through hard times. And by that, I mean, you know, the world is always changing, and we have to be ready to accept and adapt. We may not like it. It's life, and life is full of changes. And we have to control the things that we can and adapt to the things that we can't change. And we have to find ways to make it work for us. And by that, I mean, just like when we were diagnosed with kidney disease, we didn't like it, but we learned to adjust, and we found ways to cope. And through learning and experiences, we're able to live on in spite of the adversity or the difficult situation, you know, that we were facing. So, you know, we are and will always be warriors, and we'll thrive and survive if we stay informed. We have to stay engaged. We have to stay empowered. And social media is really a great way to stay connected. We have to use what we have in order to be able to adapt and cope.
Great words. Thank you so much for that, Dawn. And thank you to Janice for what you shared. Today, our speakers have shared ideas and resources for staying connected. We'd now like to introduce a new resource from the ESRD NCC. This resource offers information for patients and professionals that provides ideas on how to connect with others while also practicing social distancing. It offers hints and tips for texting, emailing, and using resources such as messenger apps and FaceTime. You can access this resource and many other COVID-19 related resources at www.kidneycovidinfocenter.com. We'd also like to share a few other resources with you. If I can have the next slide. We have one, there we go. Dawn and Janice, the All Kidney Patient Support Group that Janice talked about has a website, which is www.akpsupportgroup.org. You can also support All Kidney Patient Support Group on Facebook. And you can also search the New York State CKD Champions on Facebook as well. And we provided a few other organizations you may want to consider reaching out to, as they offer some sort of support programs or peer connection programs. And today, each presenter mentioned reaching out to your community resources. So if you're interested in reaching out to community resources, we recommend that you talk to your ESRD network to learn about those resources that may exist in your area. If you're not familiar with your ESRD network, you can find your network by going to the ESRD NCC website at www.esrdncc.org. And right now, we are to the point where we would like to hear any of your questions. If you have not done so already, please submit any questions you might have using the chat feature through the WebEx or the Q&A feature. And I'd like to ask Matt if he can share any questions with our speakers that we may have received.
Thank you very much, Kim. And we've received a couple questions here, and we do have about 5 minutes or so to address questions. So I'll jump right into it. Our first question, this one's directed to you, Janice. And the question is, I've tried numerous times to get a support group started in my area without success. And I'm finding that patients are reluctant to give up any more of their time for a monthly meeting. So I think this is a two-part question is, how did you get yours started and maintain it? And secondly, I think with this situation, are you seeing any increased activity or participation with, the quarantine?
Well, the first way I was able to get the support group started was I found another patient that was just like myself, an empowered patient. And we started visiting and doing a booth and setting up at any vendor, any health fair, anybody that was having an event. And from there, we started going out and talking to patients, and somebody knew somebody that had somebody that was in a dialysis center, or somebody cousin or family member was on dialysis, or somebody passed and that was on dialysis. So by connecting to people that way, going out, that's how I started the support group and getting more patients that were like myself, empowered, eager, ready to advocate, ready to do something. So that's how I first started out, just attending other health fairs, getting involved with AAKP, getting involved with the National Kidney Foundation, subject matter expert, doing all of those things, and from there going out. Now, the second thing, I do found that patients are being more involved, because when we have the food drive, by me aligning myself, when I heard that Dawn said aligning with other agencies, we aligned ourselves with a local agency here in St. Petersburg that is giving out food. Well, she wanted to do Pacific food for dialysis patients. By me aligning with her and giving out food, I'm able to talk to the patients, and I was able to reach more new patients than me walking into the center. So, yes, I have been able to get more active patients through this COVID-19.
So there are some unintended benefits that we don't necessarily see, I suppose, but that's great that patients are more involved. This one, Don, this question is for you. What advice do you have? Well, I'll preface this by saying you talked about using the tools that we have at our disposal, social media in particular. What advice do you have for those patients who aren't on social media or who don't know how to download an app on ways that they can connect to their fellow dialysis patients or family members?
Well, I always say you go back to the things that we started with, which is the telephone. The telephone works. There are support groups, particularly our ESRD network has a weekly support group for anyone. You don't have to be in any particular state. You don't have to be a New York patient. Same thing with CKD Champions. You can reach out and touch somebody that way. And use that good old telephone. And if you don't know how to use some of those things, it's always great to get someone else involved. If you can get a hold of your social worker, I'm sure that they would be really happy to help you find or learn how to connect to certain, certain areas of support. And in New York State, I don't know about any other states, but particularly in public housing and our seniors, there are foundations who are giving out tablets and smartphones so that people can be connected. So you might want to check with your State Department or your local city or town and find out if there are any giveaways for smart devices. And this is a great time to learn how to use it. We have nothing but time.
That's right.
That is true. Janice, I have one question for you. I think I have one more for each of you, actually, before we're going to get to our conclusion. You talked about bringing Zoom in and using Zoom. Have you had any particularly difficulties with either Zoom or some other similar tool with some patients? And how easy, if so, how easy was it to get past those?
Well, I am still having difficulty getting patients to get into Zoom. I have some of the techie patients that are, the younger patients that are real like, oh, it's no problem. But the older patients, I've even done something where I walked in the center when I was able to go in and did a Zoom lesson. I like Don said, I love going in. I would take my phone in and I would show them and sit next to them while they're on dialysis. This is how you do the Zoom. Let me download it for you. I downloaded it, and, and then I said, now, if we have a meeting, this all you got to do is just, I'm going to email you a site, and all you got to do is click this blue button. Just click this little link right here. That's a link. So that's a still work in progress. I'm still working on it.
That is a absolute hands-on solution, though, that sure works, I bet. And Don, we'll wrap our question and answers up with you. And this is actually an interesting question. It's not quite the question that was asked, but I'm gonna tweak this question for this forum. You talked about using your Facebook group and growing these support Facebook groups. Have you heard of any issues with anybody or having like clinic staff as part of those groups or whatnot? And were there any, if so, were there any concerns by patients about privacy or anything like that?
Yes. A lot of Facebook groups do have staff members who are members of the group, and I can understand why. Sometimes you may get a clinical question that a patient has, and patients have a tendency to they don't mean to, but they give out medical advice that may not necessarily be accurate. And that could be really harmful. So that can be a huge deterrent to patients for joining groups. I've seen a lot of groups where there's a lot of medical advice that's been given out that's not particularly accurate or not the best advice. So I would be really careful about joining private groups where you can just share it all. There are certain questions that should be directed to your care team and your care team only. And that's a part of being an empowered patient. And that's what we endorse in CKD Champions. You talk to your care team about medications and things specifically geared towards your care. Facebook is a great place to share and to kind of commiserate a little bit, and we give a lot of love and understanding, and we post articles and information, and we'll talk amongst ourselves about what we saw in the article and things like that. But we don't get into the medical, clinical information at all.
Don, that is great advice, and
no way.
The folks online appreciate that. I know we're at 5:30, a little bit after actually. I just want to say thank you to both of you for answering the questions and being part of this event today. We really appreciate you sharing your experience and expertise with us. So thank you so much.
Thank you for having me. It's my pleasure.
Yes, thank you for having me. It has been a pleasure.
You're very
Don,
welcome.
Great. I got to talk to you.
All right. Well, let me go ahead and wrap this event up, folks. And for those who are still on the line, I really do appreciate you being here still. Before we get to our end, oops, a little too fast there. The slides are just jumping. We want to talk about the kidneyhub.org. This is a new tool that we've created, the NCC. It is a mobile-friendly web app, if you will. We talk about all these resources that are being created. Many of these resources are available on the kidneyhub.org. It is a secure, mobile-friendly tool developed by the NCC with assistance from our patient SMEs who had a say in shaping and forming what this tool is. And as you can see, we do link to important resources such as COVID-19, resources on transplant, infection, well-being, etc. And also, for those of you who may remember receiving the new ESRD information packet, the NEPOP, all of our NEPOP materials are out on this mobile tool as well. So we encourage you to go out there, visit the site, take a look around, and let us know your thoughts on what you see out there. It is constantly being enhanced and added to, so please do check it out and return frequently. Our next events, we'd like you to save the dates for these events. They are still being fleshed out here. We'll be posting information on them this evening and tomorrow. But our patient-focused event, our next one, is 1 week from today, as May 5th, 2020, at 5 p.m. Eastern Time. And our next provider-focused event, well, we actually have a provider-focused event tomorrow, and then the following week is on May 6th, 2020 at 5 p.m. Eastern Time. And as Kim noted, you can visit www.kidneycovidinfocenter.com for information on those events and to find out how to register for them as well. And that does bring us to our final slide. We want to say thank you for attending today. We did go a couple minutes over, but hopefully you found the information shared by our SMEs today to be very helpful and informative and useful. On the screen, you do see some additional resources, such as CASER and our ESRD NCC site. And we do encourage you to go out and visit those sites to see what is new, as we are always adding new information to each of them. So I'll wrap up by saying thank you again, and we hope that we'll see you on a future patient education quickinar. Thank you.